E-cigs and vaping, working with our school administrators that are out in the field, they'll tell you quickly that it's become more prevalent over the years and increasing at lower ages. It's in every school, I believe, in the United States, and our district is no different. Our students don't really understand the impact of what it can do to their health. We're seeing it all the way down to 5th grade in our school district. So right now, it's an epidemic, and an epidemic not only across the United States, but in every district in our state as well.
So our mission is to be a catalyst to improve the health of Arkansans through evidence-based research, public issue advocacy, and collaborative program development.
Arkansas Center for Health Improvements is that catalyst. They are that entity that really helps to address issues from an advocacy policy perspective, but also backed with the evidence-based research.
I think the danger about vaping, particularly in our youth, are that it's kind of the new fad, and so that kids are trying it. There's no odor, there's no smell, they can hide it very easily, but what they don't recognize is how addictive a product it's delivering and potentially how dangerous it is to vaporize liquid and breathe it into your lungs. I think parents are relatively blind to this, although the news has been raising their awareness. This is something that I think is much more pervasive, particularly in some of our communities and at all levels of the income strata of students across our state.
As a student, what I think about vaping is that there's a lot more people that do it than adults realize, and it's quite worrying, if I'm being honest, because you see it everywhere. And when you go up to colleges to visit, I've gone up and I've stayed with a few friends I had there in college, it's everywhere. I mean, it just has taken hold of everything. It's grabbed the youth culture and it's not letting go.
Students have a challenge with it because they don't think it's a big deal. They don't hear a whole lot about it. And when they use the devices, it really doesn't taste like the old-fashioned cigarette smoke. They all report that it tastes like candy. All the fruit flavors now they're involved. So really with the coolness aspect of it and the fact that it doesn't make them really sick right off the bat and it tastes good, that's what's become the major issue for us.
The flavorings and the packaging are really designed to attract minors. Although only 3.2% of adults use e-cigarettes or vaping products, 20.8% of middle school and high schoolers are current users. So this product, which was supposedly intended for adults, has been a failed product when it comes to adults, but their growth has been all due to illegal underage vaping and sales.
As vaping products entered the U.S. marketplace and penetrated Arkansas over the last decade, I became very concerned because of the lack of regulation, the widespread uptake, and the unknown health risks from this new inhaled vapor. Electronic nicotine delivery devices deliver nicotine, which is highly addictive and has no medical value, and the substances that are vaporized and inhaled into the lungs, I'm concerned still that this is a new and emerging epidemic that we're only seeing the tip of the iceberg.
ACHI and the Arkansas Department of Health have a number of areas where we've been working on over long term, including areas of tobacco prevention and control. The vaping issue is more recent and it's rapidly evolving, but that's one where we've been working and ACHI has been working and we've been really intersecting quite well. ACHI has done some good data analyses which we've borrowed from in terms of our policy recommendations to the legislature, to the governor's office, and we've actually had a chance to co-present before the Public Health Committee of the state legislature.
To address the vaping threat, ACHI has taken several different positions. Our policy board sent to all members of the legislature a warning about this at the start of the General Assembly last year. We've tried to document and advertise the lack of regulation. Our General Assembly unfortunately prohibited local communities from being able to locally make restrictions on these, so it does fall at the governor's and the General Assembly's lap. We're trying to educate those members of the threat, we're trying to lift up and highlight the threat to the public, and we're trying to engage our clinical workforce so they recognize what to look for and what to advise their patients about the risk. As our center enters its third decade, I think we have fulfilled the original purpose that was set out, to be true to our mission, to be a catalyst for change while working with others. We have been charged with making change happen. We don't have deep pockets within which we can influence the decision makers, but by putting credible information in a timely way in front of policymakers as they have questions about what they should do, I think we've had a strong effect on tobacco, on health insurance coverage, on obesity prevention, on the clean indoor air that people breathe, on the fluoride in our water, and I think we'll be successful in this vaping effort also.